Welcome back to Body Beautiful, and we're welcoming back to the show Dr. Michelle Place. We will also be taking your calls with any questions you might have about plastic surgery. Here's the number to call, 800-440-4884. And again, we'll be putting the number for the doctor's office up during and after the segment. So be ready with your pen and paper to write the number down. And remember, any advice we give you today, obviously you're going to want to consult your own physician. Welcome back, Dr. Place.
Thank you very much. It's great to be back.
We had so many questions. You also mentioned that you got a lot of phone calls, people you hadn't heard from in a while.
I did. There was a lot of interest about the show and people that had watched it. And
well, hopefully we can start to answer some of those questions that we left off on. Eyelid surgery was something that it's very big right now in this country. Why is that? I mean, obviously we hear the eyes are the windows to the soul. But why is it so popular with men and women?
With men and women. And I think to a certain extent everybody runs into this problem. Is you'll go into the office and people say, well, you look tired. Did you get enough sleep? And you think, well, I did get enough sleep, but you're starting to get a lot of loose skin and it's starting to make you look tired even when you're not. And that's usually what brings people in. They just want to look rested and they want to look natural. And that's what eyelid surgery does for you.
Now, there are a couple of things that happen. There's the puffiness that is down there, and I can use my eyes certainly as an example. And then also the upper lid. Maybe you can talk to us a little bit about that. It's called
blepharoplasty.
Easy for you to say.
Right. And certainly the upper lid, I think, is one of the things that people notice first. You get the loose skin, and genetics plays a role. If it runs in the family, you're going to get it earlier than others. But certainly everybody gets some loose skin. And then the lower lids, you'll get puffiness, and especially if you're prone to seasonal allergies, which a lot of us are in this area.
You've had a few too many glasses of wine the night before?
Yes, had a rough night. And so certainly you get some puffiness. But what the eyelid surgery does, what a blepharoplasty does, is just restore the eyes to looking natural. So your eyes look brighter, you look rested, you look more like yourself, but you don't look different. And I think that's really the nice thing, especially for men, is you don't look artificial. And that's what they're afraid of. They're afraid they're going to look very different.
Now, I don't want to minimize what eye surgery is, but in the scheme of things, is it one of the easier things to accomplish your goals with? I don't know how to phrase that, but
it's one of the simpler procedures. Certainly still a procedure, but definitely quicker recovery. It's less insult to the body, and the procedure itself has less pain involved, and so it definitely is one of the easier procedures that we do.
And as opposed to, say, rhinoplasty, the nose job, because there's, well, it's a functional thing. I mean, not that eyes aren't, but also it's also the aesthetics of, I mean, how do you get it just right?
Right, and it's a lot bigger surgery, and so you do end up having to spend a lot more time recovering and waiting a lot longer to get the results.
Another thing that seems to be very popular these days is, liposuction, but not just for the tummy area.
Right, absolutely. And it's certainly body contouring, and you can do it really anywhere, but one of the more popular areas is the neck. And sometimes we even combine it with, say, a little lift if you need to get a little loose skin taken off.
Now, I know that you did bring some photos, and we're going to take a look at that after the break, but you mentioned also that men are having this done a lot more as well.
Absolutely, and a lot of men end up with almost, say, a turkey gobbler neck. But they really don't want to do anything with their face, because sometimes a facelift in a man can feminize them. And so men really want to get a little more definition of their jawline, to look at the stronger jawline, and not be feminized. So sometimes we'll do a neck lift just to clean up that jawline and clean up the neck.
We're seeing a lot of this in Hollywood, and certainly we don't want to minimize the surgical aspects of this. And there's some pain involved, and this is not just something you can just snap your fingers and voila.
Right. It's not just a trip to the cosmetic counter. It definitely is surgery. You have to take time off to recover, and especially if you don't want people to know, you've got to take a little more time off to recover. But it is a nice change, and it certainly can make you look better and feel better about yourself.
And a lot of people are doing this because of the competitive job market out there. They're trying to do everything they can to stay competitive. We need to go to a break. We have some before and after pictures, and the phone lines again lighting up, also some emails. But if you want more information about Dr. Michelle Place, you can call 925-837-1347 or go to michellejplace.md.com. And when you call our office, mention the show Body Beautiful, you'll receive 10% off the laser and skincare products for the month of December. Welcome back to Body Beautiful. We are here with Dr. Michelle Place, plastic surgeon. We're going to be taking your calls about plastic surgery. The number to call, 800-440-4884. Remember, any advice we give you today, you sure want to check with your own physician. Okay, doctor, we have some before and after pictures. Let's jump right into those because obviously they're going to tell us a lot. We've got a tummy tuck. Oh my goodness, what a radical difference here. What did you do?
Well, this is probably a more common patient than, say, one of the ones we showed on the last show. And this is a lady who, after a couple of pregnancies, she's gotten back into shape, and she still can't get rid of that loose skin, and it's stretched out skin. So there's no way for that to go away. And then with just taking out that loose skin and tightening up the muscles, then she can see the results of her exercise.
And she can wear a bikini. It looks like she's been on the beach and happy to do so. Let's go to the next shot, which is before and after of a man's neck.
Yes, and a lot of men are coming in just to refine the neck and the chin area, but they don't want to look too tight and too artificial. And you can see here that with a little liposuction and a little bit of tightening of the muscles, he has a very nice contour to the neck, and it looks very natural.
So no one would be the wiser. Right. They might think he lost weight.
Exactly, and that's what usually is. They think he lost weight, even though he may be the same weight. It just really changes the way he looks.
Now, are there exercises you can do to achieve the same result? If you get a little flab in your midsection, you do some bench presses, but this is not something you can do facial or neck exercises.
That's loose skin. That's not going to change no matter what you do.
Too bad.
Right.
And what are we looking at here?
And these are eyelids, just upper eyelids, so it just takes away that tired look and makes the eyes brighter, but you would never know that someone had had plastic surgery. She really just looks rested and just looks brighter. A
little more defined and yeah, beautiful. Okay, I promised. Let's go ahead and do this one email before we get into the phone calls. This is, my friends often ask me if I'm tired. We were talking about this before. What could she do to look less tired? But what's the least invasive procedure? This is Joni from Santa Clara.
Well, certainly you can start with skincare and doing some creams and things like that. And it does a little bit. Certainly it helps with the skin and makes you look less tired.
Cucumbers?
Right,
Ice
cucumbers
packs?
Help a little, just, temporarily. But if you want to bump it up to that, you can do some lasers and some non-invasive lasers for a little skin tightening. And then, of course, the next step is to move up to something like an eyelid lift. So a surgical procedure. So there is a whole range of things that people can do depending on their lifestyle.
Now that's pretty new, the idea of lasering, but that would have to be if the skin is really loose or it's really, it wouldn't give you the effect.
Well, it's more for lines and wrinkles. The laser definitely improves the skin. To get rid of loose skin, you need to remove it.
Okay.
So, yeah.
All right, let's go to the phone lines. Jennifer from Oakland, are you still with us? I know you've been waiting a while.
Yes, I am.
Good morning.
Hi. My question is, do you get better results with smart lipo versus traditional, and how quickly can you see the results of smart lipo?
Thanks, Jennifer. What is smart lipo?
Smart lipo is a new technique that's come out, and it's put out by a company that produces a laser where you can put a small filament through a tiny liposuction cannula, make a small incision, put it in, and then the laser breaks up some of the fatty tissue. And so it's great for small areas, and especially around the chin, it's very good for that. But for a larger area of liposuction, you would need a more traditional liposuction. And it doesn't suction out the fatty tissue, it really just breaks it up and lets your body reabsorb it. And some people use it if you've had liposuction and you have a few areas that are still a little lumpy or bumpy. You can use the smart lipo to break those up and then let the body absorb it.
Jennifer, thanks for asking the question. We've got another caller from Oakland. Rita, can you ask a quick question to the doctor? We have time?
Yes, hello?
Hi, good morning.
Good morning. My question was, when the eye starts to look tired and droop, can you use a cream to tighten the skin, or do you have to have an actually lit eyelid?
Well, the creams do help a little bit to get rid of some of the crepey looking skin and to moisturize it, but when the skin starts getting loose, there's really nothing that's going to tighten that up except removing that loose skin. So you really have to step up either to a more invasive laser or really just to the eyelid lift.
Of course, there's a trick in Hollywood. Don't they put tape or those bands like this? And
Yeah, you
know,
can tape it up.
you can tape it up. No one will be the wiser. Right. Thank you, Rita. Thanks for calling. It seems like what we're really talking about here is, everybody's looking for the panacea.
Right.
You go to the drugstore and you watch the infomercials on television. They all are talking about some magic cream. Is it just that creams have a limited effect? I mean, they just don't absorb into the body as deeply, or you tell me.
Yes.
Is there anything that works?
There certainly
besides surgery?
are. Yes, there definitely are. And there are some creams now available that are by prescription and definitely do a lot more for the skin. We use a line called Obagi, which is very aggressive, and it's amazing the results you can get with it for pigmentation and sun damage, and really get a healthy looking skin. And then, of course, taking care of your skin, no matter what you do surgically, is going to look better than someone who's just out in the sun all the time and getting more sun damage. So
good advice.
It definitely has a place.
All right, Doctor, we have run out of time. I can't take any more calls, unfortunately. I guess we'll have to have you back. For more information about Dr. Michelle Place, call 925-837-1347 or go to michellejplacemd.com. And when you call the doctor's office, mention the show Body Beautiful. You'll be able to receive 10% off all laser and skincare products for the month of December.